So today I'm going to be interviewing Dr. Carolyn Dean, who's been at the forefront of health issues for over 40 years and is the leading expert on magnesium. Dr. Dean is a medical doctor, naturopath, herbalist, acupuncturist, nutritionist, and inventor who has authored and co-authored over 35 books. And today I've asked Dr. Dean to speak in regards to the role of magnesium in pain relief. Many people suffer from both chronic pain as well as episodes of acute pain. Some suffer from muscle, nerve pain, many others from joint pain, either from their finger joints, their shoulders, their hips, their knees. And so I would like Dr. Dean to shed some light in terms of the role that magnesium plays with pain. So I wanted to know from a magnesium specialist like yourself is what type of pain is magnesium best suited for?
Okay, so that puts me in a bit of a bind because when we talk about magnesium and pain, I have to say right away, magnesium is not a drug that will take away pain. Magnesium, as we've talked about before, is necessary for 80% of known metabolic functions. It works with muscles and nerves to make them function properly. So if you don't have enough magnesium, then you can get magnesium deficiency pain. In the muscles, it would be cramps, the tension of fibromyalgia, the horrible Charlie horse cramps that I used to get. You can get heart pain, angina. So all these pains, you can be taking magnesium in order to treat your deficiency, and the pain will be relieved. I mean, when I first started taking my own magnesium, which is a stabilized ion of magnesium, I used to get the laxative effect with any other magnesium, so I had to create my own stabilized ion version of magnesium. I had to take 1,200 milligrams for a year before I got my heart palpitations under control. And lo and behold, my low back pain went away and all kinds of twitches and different things that I had. And a lot of people, they'll approach us like that. They'll say, oh, I want to take your magnesium because I don't sleep well. And then, oh, this ache or pain went away. Nerve pain, the same thing. A lot of people with diabetes get nerve pain, in their extremities for lack of circulation, or, the glucose jamming up in their cells and swelling the area near their nerves. So the treatment for diabetes, part of the treatment is taking magnesium. And then lo and behold, it relieves their extremity tingling. The twitching, I used to get eye twitching, and that's a magnesium deficiency. It wasn't a pain, but burning, tingling type of pain with the nerves can be relieved if it's being caused by magnesium deficiency and you take magnesium. Now, if you've got injuries or, develop a, big bruise, or your Charlie horse cramps up and you're limping around the next day, then you can apply magnesium lotion locally to these areas, and it will be absorbed readily. Magnesium is really well absorbed. So, I mean, that's sort of how I deal with pain. And magnesium is tell people, maybe you're deficient, try getting saturated and see what happens.
Along with the lotion, I understand epsom salts is something people can do. Is that correct?
Of course. Epsom salts baths. Yes, the naturalists and the midwives have been using Epsom salts for hundreds of years. It's well known to relieve muscle cramps, help with your fatigue. Magnesium is necessary to create energy in the body. And every once in a while you'll read an article, Epsom salts, is it absorbed? I have this story about a patient who fell asleep in her Epsom salt bath, and she was awakened to rush to the bathroom because she got the laxative of that because she absorbed so much. That's my story. So we know it's absorbed. It really is.
Okay. And people have to use like a cup or so of it.
Yes.
not just a little sprinkle or anything.
No, you're right. Yeah, a cup or two, and you just titrate it for I don't know, titrate meaning you start low and work up. But you hmm, all that can happen if you put in, say, a whole pound of Epsom salt is you could get the laxative effect, or it could make you really drowsy and really relaxed. And well, think of what are they called? Um, the tanks that people lie in, uh,
Oh, like
where
salt,
you're lying.
you're floating in these,
Yeah,
yes.
floating tanks. That's Epsom salt that you're floating on. And that's what it's not just the dim lighting and the enclosure. You're actually absorbing Epsom salts through those flotation tanks.
Now you mentioned with, some of the pains, it can take as long, as a year to start to get reduction. With muscle spasms, if you just put it on topically, it could take, I guess, minutes. So it's a bit across the board, my understanding, in terms of how quickly magnesium will react, depending on the source
Right,
of the pain that you.
right. Yeah, it's hard to give a timing for it. I know one of my Amish practitioners yesterday was talking about how he was taking it for his atrial fibrillation and was quite amazed that that went away. And then he said, and then I noticed that my low back pain was going away. I think it sneaks up on people. It certainly snuck up on me where perhaps it had been months earlier that I stopped having this pain and I just didn't remember it. We tend to forget pain, especially women who've had babies.
That's a good thing, or we wouldn't have a second. Yeah. So is there,
Exactly.
yeah.
Mm-hmm.
Is there anything else? And I know there's so much that you have in your book, but for the general audience, just starting to understand the relationship between magnesium and pain, is there something globally that you could share in regards to this area, pain and magnesium?
I think partly what the magnesium is doing for pain conditions, especially joint pain, is it's helping to naturally dissolve the calcium and calcifications that are in soft tissues, so that taking it long term is very important. Taking it orally and putting it on locally. I mean, you're asking about pain, but I'm going to say now that we've had people who've told us that their carotid artery calcification is diminished after taking, well, our magnesium, because it's helping to turn these calcium deposits into deposits into calcium in the blood that then goes to the bone where it should be. So all these things that, these natural things that we're talking about, they do take time. They do take commitment. You can't just take say a new magnesium product for 10 days and say, well, that didn't work. You have to read about it, listen to this type of interview and educate yourself and kind of get it in your brain that, oh, this could help me. Let me look at all the ways that I may be magnesium deficient, and then let me just observe what happens as I start taking magnesium. Some people, they'll tell us they want to take the magnesium for a back pain or muscle spasms, and they'll say shortly after, oh, I started sleeping better, or that twitch went away. So their major concern, which may be their priority, that's being worked on, but other things are starting to be reduced. So if you're observant of your whole body and not just think, oh, that I still have that pain, then you don't recognize what else is going on. We just have to be more responsible, not only for our lifestyle and our diet and everything, but also observing, our own body. The doctor does not know your body like you do. I mean, I had people in the beginning in my practice in Toronto say, well, you're the doctor, you tell me what's wrong. And I didn't know your body. So we have to take more responsibility for our bodies because they depend on us to take care of them for a lifetime.
I totally agree. Could not agree more on that one. Thank you. And thank you for all your work in the area of magnesium and for putting it in a format that we can all read and use as a resource, both for healthcare professionals and lay people alike, and just for explaining a little bit more the role of magnesium in pain management. So for that, thank you so much.
Oh, and thank you, Margaret, for all that you do putting out this information. It's a lot of work, and I know I appreciate it, and all your listeners appreciate it as well.
If you're interested in videos on physical therapy and pain management, I've created a playlist just for you. Thank you for joining me, and I wish you a lovely day.